that doesn't mean that the MSD is not supplying drugs, but it's a changing. The type or the drug is changing, but we have a shortage of around 60 drugs which are vital, and sometimes we have to purchase through local purchasers. Some we get them through the donation. So main problem, I understand that when a shipment is ordered, sometimes it does not arrive on time, so there may be some gap in between this supply chain. We have to sometimes this shortage of drugs may be changing from day to day. It is changing, so it's not a static one, it's a dynamically changing situation. So we know that however, LRH has the largest hospital for the children, which provides services free of charge. It is considered as one of the largest hospitals in this type of hospitals dedicated for children. And this hospital is the apex hospital. That means all the children with a lot of complications are sent here from all over the country. So when they reach this hospital, they are under our care. So we can't say that we use around 900 drugs as a total. So about 60 drugs out of, we can't say that only 5% of the drugs are not available. Your child comes under that 5%, which we don't have the drug. It's not an answer we can give to the parents, because they believe when they come to LRH that their child will get the utmost priority. So that's a challenge we face every day, because we can't say no to these people. And other thing is, most of these people are coming to this hospital with the belief that we can provide the maximum care to these children, and they believe that expensive drugs will be given to them free of charge. So even though it is not available in the medical supplies division, so we try to get the donations from local or international donors to reduce this gap. However, we were able to continue our services throughout this COVID pandemic. Then there came the political problems of the country. Then came the economic crisis. All these 3 years we have been fighting, but not compromised any of the services which is provided to the people. Any of the surgeries were not postponed due to lack of resources. And all the clinics were maintained, all the drugs were given as much as possible. And number of patients coming to the hospital increased gradually from the COVID period to about 2 months back. That then total number of patients who were coming to the OPD was around 1,300 per day, and clinics around 1,000 per day. And admissions were around 700 patients to the total. About 250 patients, 300 patients were admitted daily. This drastically changed with the media and the incidents we faced during the last 2 months period. And this has very adversely affected the reputation of the hospital, and this had made the number of patients coming to the hospital reduce. Now only about 150 patients are getting admitted daily. OPD came down to around 800. That means about 500 patients are not coming down. So this is a relief for the staff. This is relief for the staff. The problem is for the society. So the people wait until the last moment in their illnesses because of the fear to come to the hospital. So we have to understand this problem a lot. And we know that even in USA, 100,000 people die every year because of the incidents and accidents of the healthcare system. This is a similar incidence in Australia, US, UK, France, any developed countries. The incident rate is less that much. That kind of high risk. This is an industry which is very high risk, which is sometimes being compared with the nuclear power plants risk. So more than that, my belief is it is more than that, because nuclear power plant, there are fixed things to be done. Here we have to adjust according to the patient's need, patient's diseases from one person to another. All the things are becoming very difficult. So incidents happen, but because of the ignorance of the people about these incidents and accidents happening in hospitals and healthcare systems all throughout the world, they are concentrating to a single or very few number of cases, and themselves put themselves into danger. They keep their children for a longer period in their houses, and when they come to the hospital, sometimes we may not be able to help them like we could have if they have reached earlier. So this is the situation now. There are problems with the regard to the consumables like surgical items, sometimes building maintenance, and all the other equipment and medical machines which we use. We need this now. It is almost about 5 years old. All of them are more than 5 years old. Now most these machines are getting a lot of repairs, and we have to always spend money on those. A lot of money carries with this industry, and we have to keep the maximum functionality of these equipment, hospital buildings, central AC, central air conditioner systems, and all the ICUs, theaters, everything we have to be keeping the best possible condition, because it is not an option for us to just close down units or omit patients getting into the units. So these things are there. Now we are facing the problem. Lot of doctors, I have mentioned this about 2 years back. This first time I mentioned that there will be a problem of staff leaving the country within next few years. Now it is happening. Because we always try to put the blame on doctors with regard to this issue. They say that doctors have learned from the free education system, as others have not. All the engineers, all the accountants, all the computer software engineers, architects, even the beggars have learned from this free education system. Putting the finger towards only doctors is not justified. So I believe there's a problem. Not only doctors, nurses, paramedical staff like MLTs, pharmacists, physiotherapists, occupational therapists, eye technicians, speech therapists. There are various kind of paramedical EG technicians. So many kinds of paramedical staff. They also leave the country. And on top of that, minor staff, that is healthcare assistants, attendants, they also leave the country. Now, doctors, when they leave the transfers, doctors are coming to Colombo. That is one thing that we can keep up with this problem. But the effects will be in the peripheries. The doctors will move towards Colombo anyway, and those units will be closed. So we are maintaining our functions, but they can't maintain that. That ultimately will result in transferring these patients to our hospital and increase the burden to our hospital. So we can't say that we don't have problem. Doctors are leaving. So we have on the other hand, nurses also, when they get most of the nurses are from the degree programs, and when they get the degree, they directly go abroad. They do not come to the health system. We predict that this number of nurses will come, but about 10%, 20% of the people are not there when the appointments are given. So this is another problem. And our system always try to say that making these people, creating a doctor, creating a nurse, we are spending so much of money. But we have to understand, with the free health system, for the examination of patients or any other things, we are not spending a cent. We are only spending for the lectures and things. Other things, when we go to the medical faculty, we have to photocopy all the lecture notes. We have to get our own books. They are not being provided by the government. Only thing the thing being done is the lectures and the lecturers' payment. So this, I believe, relative to the other countries, our country spends less for the making of these professionals. So we have to increase the number of people who are being admitted to these medical faculties. Sometimes it may be private ones, but there should be a criteria to admit these people, and output should be larger, because we have to compensate for the people who are leaving. So that we have to do, because getting doctors from abroad is not an option for us. I don't believe anyone would come to Sri Lanka for this salary if we advertise from the foreign countries, and we would not get the quality of these doctors who are being passed out from our university system from other countries. Sometimes they may be suboptimal people. We don't know what would happen. So we have to protect our staff, and we have to use some kind of they should be given some kind of security about their future and their future for their children. So that is the most important thing, I believe. Not the monetary things, but security for the security and shelter and basic things like not being debt when we are leaving. So basic things need to be covered. Otherwise, people will leave the country. We can't stop them, because even though we try to do it through regulations, they will vacate the post and go. It's a matter of decision, because if they feel that working here is more important than going, they will stay. Otherwise, they will leave. We are not giving them the security of working. They don't have any insurance. Sometimes people might come and stab there with knives. Incidents have happened, but nothing has been done to safeguard these dedicated staff. So we have to go. This has been raised by several consultants of LRH, like Dr. Ipal. We know that certain pockets of malnutrition is there in the country. Not all the people malnourished, but it's a two-end issue. Some are obese, some are wasted or stunted. So this is a spectrum. New malnutrition, there's a burden in the two ends of the spectrum. So we have to, here we saw that during the severe crisis, last October, August, that period, we couldn't provide food properly to the children because we didn't get any these feed items and eggs. We couldn't get them to the hospital. But now it is settled. We can give the diet to the patients who comes to this hospital, and we provide diets to the parents of the person who's with the child. Both we give the food, and it's a reasonably good diet with protein, carbohydrates, and essential nutrients. But when it's a large amount of people coming to this hospital is from the suburbs and it's around the Colombo area. So we might not see the actual gravity of the problem through these patients, because they are be thought to be having a better life in these 2-3 districts, Western Province people. But when some patients who are coming from all over, from faraway places, they may have a lot of problems. We have not assessed it objectively with this research or something. If you could, I think you can have a good assessment. Nutrition problems, the main issues are micronutrient. There are micronutrient problems, anemia. Some nutrients are not rich with these micronutrients. There are major nutrients. We believe that is for the certain social group who are below the poverty line. There may be nutritional problems, and you can get a good conversation with Dr. Manoji, who's the nutrition consultant here, and I think he can give you the understanding with regard to the nutrition problem. There's no such a program for family planning. There's no family planning unit in this hospital, so consultants and doctors may advise them if they are multiparous and more than 5 children or something, then we can advise them. But it is major. It's a component which is being handled by the VOGs and maternal care staff, so from the field staff. So that is we have less exposure. And we don't. We have the other things like adolescent sexual transformation problems. Lot of clinics are there, but family planning we are not doing. They advise them. They get the genetic testing done from the medical faculty. We diagnose them and say whether they have the same risk for the next pregnancies, and those things have been advised. Those congenital abnormalities, we always try to reduce the risk, because similar incident in the next pregnancies, subsequent pregnancies would be disastrous to the family. So we always give them counseling, and we are trying to establish a parent counseling unit also, because some parents, some mothers are here for a long period, like cardiothoracic surgery. Sometimes CP patients, like cerebral palsy patients, they wait for longer periods, and sometimes they get a lot of psychiatric issues. We have to address those people, but till these adult counseling and adult treatment is not done at hospital. So we are trying to establish that one with the help of the psychologists and the psychiatrists. The problem is the space in hospital, because all the areas are being occupied in the moment, and the new buildings which were supposed to completed on time is dragging on because of these things. And we were supposed to finish this Little House project this year, but it seems that it will go up to next year's December. When these projects get delayed, the space we need for these specialized things, sometimes we can't establish them, because we need some kind of space for these clinics, and sometimes people need to relax their minds, and they should be given counseling. Sometimes it cannot be done in a small room. Sometimes it may need more space and atmosphere. Otherwise, starting a thing just with the thought is not enough. We need resources.